fellow viewers and or listeners. My name is Hung Pang. I'm the managing director for Propel Physiotherapy. I am joined today with our awesome registered physiotherapist and clinic manager of our Etobicoke location, Amanda Raguseo. Amanda, how are you doing today?
I'm doing very well. Thank you, Hung. How are you?
I'm doing very well. I'm very happy that the weather's sunny. It's still kind of cold, but you know, we're moving in the right direction. So today it's an opportunity for our fellow listeners to kind of get to know our physiotherapists a little bit more, and in particular you, Amanda. You're spotlighted today, and we're going to put you on the spot. We're going to ask you a couple of questions just to get to know you a little bit more, and we'll see where this discussion takes us. Is that okay?
Sounds great.
All right. So, I mean, for those of you that don't know Amanda, she's very active, both in the gym, outside of the gym, lots of sports, lots of like contact, non-contact sports, just overwhelmingly, you know, involved in physical activity. Practice yoga. I've seen you kick some serious butt in Thai boxing. Can you tell me when you first developed a love of sport and how that translates into your current work or role as a physiotherapist?
Yeah, absolutely. So growing up in an Italian household, sports, specifically soccer, was very much a part of my life growing up. So
Yes.
I think I was maybe 3 turning 4 when I was sort of put into my first sport. You know, Timbit soccer kind of thing. You run after the ball. You don't really know what's going on. You're picking up grass.
Yes.
And then over the years, I kind of developed into a little bit more stronger passion. The skills got a little bit better. Continued with soccer all up until about the beginning of the pandemic, actually. So I was playing soccer for about 24 years.
Wow.
Picked up another couple sports along the way, basketball and volleyball. If you guys have ever seen me in the clinic, I am about 6 foot. So sports were kind of a natural progression for me.
Yeah.
And I just like being in that sort of team building environment. And I think that's kind of the biggest thing that I've brought into sort of my physiotherapy practice. I try to make you guys as my team members, essentially the clients, as well as my colleagues here, we all sort of work together to create the best sort of treatment plan and try to get the best outcome so we can kind of have a collective win per se at the end of the day. And I think my competitive nature maybe also pushes people a little bit in and out of the clinic as well.
Yeah, you bring up something really good, like kind of like that team mentality. And although you're on one side of the therapeutic relationship, you know, you're only as strong as the weakest member of your team. So if both of you are working towards the same goal and you're accountable to your teammate and that teammate, your client is accountable to you, I feel like your success rate and you know, your goals are reached a lot quicker, a lot smoother, and probably with a handful of like chuckles or laughs along the way. I can attest to Amanda. She's 6 feet. I think if she has like different shoes on, she kind of overtowers me a little bit. Yeah, we'll leave that for another discussion on our height comparisons. All right, so let's get down to some educational stuff. I understand you graduated from McMaster, similar to me, a McMaster alum. Yay! You know, can you tell me, what did you learn from your experience, you know, going to school there, and like how does that programming kind of differ from maybe some other programming throughout Ontario or throughout Canada?
Yeah, so I actually did my undergrad at McMaster University, and then I did my master's of physio at University of Toronto. So I did get a good sense of sort of 2 different types of schooling there. And I really enjoyed sort of what they call the problem-based learning aspect at McMaster. It was very much, there is a problem you have to solve, and you need to be the one that goes to find the resources to solve that problem. And I find that translates over to physiotherapy as a practice very well.
Yeah.
I always say nobody is textbook. We have clients coming in with a certain diagnosis, but there's always an element of surprise and some puzzle piecing togetherness that has to happen as we work through everything. So I feel like kind of learning that style of learning has helped me as a clinician to better provide care for my clients.
Yeah, no, that's a great way to put it, like a puzzle piece that you need to kind of figure out. And I think everyone can attest, like not everyone is cookie cutter kind of protocol treatments. And we want to avoid that. We want to be the next generation of physios that are practicing with a lot of efficacious manner. And, you know, I often try to describe what problem-based learning was or is to other people who haven't engaged in it. And, you know, when I end up describing it, people just kind of say like, so you end up kind of teaching yourself? I'm like, yes, but, you know, there's a mentor along the way, and they make sure you're not like veering off too far within the stream of knowledge. What, you know, if you had to describe what problem-based learning was to maybe someone who is looking into the program, what would that sound like to them?
So the way you described it was pretty good. Essentially, it's a lot more independent, a lot less hand-holding than some of the other programs that I've seen or I've been a part of. Like I said, there is a problem that needs to be solved. You will have all the tools that you need to solve that problem, but it's up to you to find the right evidence or the right sort of, I don't know, the right tools to solve those problems. Nobody's going to be holding your hand and leading you through the steps. You sort of have to make your own pathway to get to that same goal.
Just like regular day-to-day clinical activity, right?
Exactly.
So the application's pretty awesome. Okay, yeah. So that's really cool. That's like a good background of you know, your education and your status. How did that compare to going to like U of T in Toronto?
Yeah, so I technically took all the ways that I learned from McMaster and I just brought it with me, because I find once you learn a learning style that works for you, and it doesn't work for everybody, but it worked well for me, I just kind of brought that learning style with me to U of T and applied it. So I wasn't the type of person that was asking the professors for a lot of help. It was more like, let me take a stab at this first.
Yeah.
Try to figure out what's going on. And then if I still need assistance, then I will say like, hey, what's your ideas, or can I pick your brain a little bit?
Help me. Yeah.
Help
me.
Yeah.
Exactly.
And I feel like I do that a little bit in the clinic as well too. I'm like, let me just do all the research that I can. Let's try all these things, and then ask for some guidance if I need that later.
That's awesome. And not to belabor this question, but it's almost like I remind everyone, and new grads especially, like you kind of have to be comfortable being uncomfortable in certain situations, because knowledge is infinite and what you can store in here is finite, right? So if you don't have that learning strategy, or like that ability to problem solve or critically think, or like take whatever pieces of data you've collected during your session, bring it home, digest, and then like present a better treatment plan next time or problem solve on that, I think you're going to feel really like overwhelmed and kind of like floundering in an ocean, right? But those are great reiterations of your learning style. So, you know, you end up working at Propel Physiotherapy, seeing a whole slew of complex orthopedics, neurological rehabilitation, clients with, you know, a good mix of clientele, let's call it. Is there anything about working in the neurological rehabilitation field that surprised you when you first started, or that it wasn't what you thought it would be like?
Yeah, so definitely going through the schooling, they've definitely focused more on sort of the acute side of neurological rehab. So someone's just been in an accident or has just had a stroke, and it's like, okay, how do we get them from point A to point B? Here at Propel, yes, we know how to go from point A to point B, but it's like, what happens after point B?
Right.
What's C, D, E, F? What's the rest of the alphabet? What's the rest of their lives going to look like? And how can I be a part of that? So that was one of the things that drew me to working at Propel, was having all this sort of almost freedom to create individual treatment plans for our neurological clients, and kind of help them through the rest of their journey to get to a functional place where they're happy with what their abilities are. And I was also very surprised at how quickly we can see results in a neurological setting. yes, there are some cases where things take a lot longer, but then there's also some instantaneous cause and effect that happens within clinic before our eyes, before our clients' eyes, and they're like, wow, I didn't know I was capable of that. And I'm just as shocked, but as happy as they are when they achieve those goals. You know, sometimes it almost seems like magic sometimes.
Yeah, you're like, yeah, I knew that. I meant to do that, right? And you know, you're both equally ecstatic. No, that's a good way to put it. And certainly it's a good balance between, you know, you're mentioning some of the instantaneous, you know, results that you can get, or like, let's call it like symptom relief. And, you know, that's a huge part, especially at the beginning, when things are just kind of really rocky, flared up, or, you know, they're just coming straight from the hospital kind of thing. And then if you're able to kind of like show that kind of change, it's really rewarding, right? But at the same time, I also think you spoke a little bit on, like, there are more, you know, injuries that have a chronic kind of component to it. And perhaps we will be seeing these clients, not, you know, every day for the rest of their lives, but there are tune-ups, right? Like they'll come in, get a refresher. Maybe there's a flare up that we need to help address, or maybe, you know, given their injuries or their diagnoses, there's like a progression in what they're dealing with, or you know, something else has happened that we need to help manage with them. So I think that stuff really surprised me as well when I first started working in this field. So very cool. I'm going to jump back to some of the sporting stuff. So you've been involved in the sporting community as a physiotherapist. Can you tell us a bit about your experiences working with sports teams, and what about this do you enjoy the most, and why?
Yeah, awesome. So kind of just to backtrack a little bit, like I said before, kind of grew up playing sports, watching sports. So I always knew sports were going to be in my life somehow. And then when I stumbled upon the career of physiotherapy, I'm like, awesome. This can be a part of my career as well as my everyday life. And so right now I'm currently working through my sports certification program. So I'm taking a course right now just to up my skills a little bit. And with that comes working with sports teams. So over the years, I've worked with rugby teams, I've worked with volleyball, hockey, sledge hockey, so some parasport and things like that. What I really enjoy about the sport side of things is the on-field aspect to it.
Right. Live.
So you're there live. You have to make decisions that are split very quick. You have to make a split decision. You have to be ready to go the entire time. There's no downtime. You're constantly heads going, heads looking. You're getting the athletes ready for their event. You're getting them ready during their event if case there's an issue that happens on the field. And then post event, you're making sure everyone's all in one piece before you kind of send them on their way. So I just like kind of the thrill, the excitement of that. As well, it kind of gets you out of the office, so to speak, for the day. You know? 3 or 4 hours on
fresh air
pitch. A hockey rink is it's just a nice change of scenery. And I enjoy the mentality as well of some of the athletes that I've worked with too. They're all gung-ho. Anything sort of I say goes.
Right.
Very sort of responsive in that regard as well.
Very cool. And you know, from there, do you see that there's any lessons that you learned from working with competitive athletes that you have brought back to the clinic and you were successful in applying to other client populations?
Yeah, definitely. I would say my communication style is a lot different with the athletes on the field versus when they come see us in the clinic, but I can still take some of that intensity and bring it towards other clients that I've seen here as well. Just giving better recommendations for sort of exercises and just movements to get people prepared to do certain tasks in their day. As well as just sort of reining people in. Sometimes I can better detect now somebody who's sort of overdoing exercises or sort of overdoing things, and just trying to sort of bring them back down to more of a baseline to prevent like repetitive injuries or things of that nature as well.
Oh, that makes sense. That makes sense. You get like a wider scope of like physical abilities, neurological abilities, and then like you can help have that, you know, mental comparator as well, right?
I find the decision making too when in clinic is a little bit faster now that I've
Yeah.
had to make a decision.
Yeah.
2 seconds on the field, I can now make faster clinical decisions when I'm here working with all populations.
Right. No, that's great. So as I mentioned earlier in your introduction, you are the manager at our Etobicoke clinic. You've had the opportunity to mentor a variety of students and new physiotherapists at Propel. What is some of the best advice you have given to people starting out in this profession? And, you know, it doesn't need to be academic advice or clinical advice, just journey advice as well as well appreciated. What's the best advice that Amanda has given?
Well, the best advice that I've given is probably the best advice that I've received from my past mentors as well. So I kind of just like to pass that along, you being one of them.
Oh.
So I will say the first thing is just be patient with yourself.
Yeah.
You have all this knowledge as a new physiotherapist coming out of school. It's in there. You just have to tap into it and utilize it. The basics are the basics for a reason, and they can go miles. You'll do more with the basics than you will do with the fancier courses and the certifications that you get afterwards. So I would say don't rush into trying to do these advanced courses for, let's say, maybe acupuncture or the orthopedic levels and of manipulation and stuff like that. Things that you think are super important, they all stem from the basics that we've learned. So hone those skills, get really good at the basics, and that is going to do worlds of good for your clients and yourself.
Yeah, thanks for reminding me on that too. That's legit. I'm like, oh, I needed to hear that because I think, you know, the number one thing we hear from a lot of our newer hires and or physios just starting out is like, oh, what courses should I take and what should I do this? And then I see their, you know, almost like their calendar of events coming up. I'm like, man, you got like a course every 3 months. Like I don't know if you're digesting that or not, right? And I don't want to, you know, everyone learns differently. Some people like to cram it all in. Some people like to digest, eat, digest. But I do recall, you know, one of my mentors telling me like the same thing that I told you, and, you know, subsequently we're passing on this message, but that it's the foundation, right? You can build all these awesome courses on this really solid foundation on clinical knowledge. And if you make sure that that foundation is solid and correct, yeah, you know, your courses and your choice is going to be exactly that. You get free reign on whatever you want to do, right? If you want to practice with more acupuncture or manual therapy or modalities, or, you know, you're interested in specific tech, then it's going to be based on those core foundational principles. I think with, you know, working in neurological and complex orthopedic environments, we often see clients with chronic conditions and injuries that require longer term care. What message do you like to convey to those clients to encourage them and keep them motivated to complete their exercises at home or their physiotherapy guidelines that you kind of like communicate to them? You mentioned the athletes earlier, and it's like, you know, they're pretty quick, right? You're like, okay, you know, everyone, you got to do these stretches, or like, this is the warm up that we're going to do today. And everyone just kind of falls in line and does it because they're there for a mission. What do you tell your more chronic conditioned clients?
Yeah. So it's a lot of education, and I think that's really important because there are very certain or specific exercises that we might think, or as physios, we know they're important. But if the client doesn't know why they're important right now in order to lead up to their final goal, there's a lot of sort of hesitation and maybe not a lot of compliance. So I just make sure that I just let people know the reason that we're doing certain things is to reach your end goal.
Mm-hmm.
And I often use the term, it sounds silly, but I say the word yet. So if someone says like, oh, I can't go from sitting to standing on my own. And I say, you can't go from sitting to standing on your own yet.
Right.
So there's going to be a time, or there's a sort of a goal of getting to that point. And these are the steps, the little steps that we have to take to get to that big goal. It might seem intimidating and it might seem sort of overwhelming. So breaking down those bigger overwhelming goals into smaller little short-term goals, I find is a little helpful for some of those kind of persistent clients that have a little bit more extensive injuries.
Oh, that's a yet. I'm going to use that. I'm taking that from you. Yet. Awesome. As a physio with extensive education, training, and experience in helping people move better and live better, what's your best advice, not to fellow physios or other people in the industry, but to the general public who I think at this time are struggling sometimes to get that physical activity level at a meaningful amount? What's your advice to them?
Yeah, I first want to say that I get it. We all get so busy in our days, we get caught up, and it seems like there's not enough time to fit everything in the day. But I just would encourage people to get out and just little things throughout your day can make a big difference. Taking the stairs if you're able to, just going for a little 5-10 minute walk throughout your day is something that seems little, but it adds up to your overall well-being. I just think about it this way. If there is a tire that's rolling, it's easy for you to just kind of push it along.
Right.
If a tire is stopped, in order to get that moving, or a boulder even, you got to push it a lot harder. So if you just don't stop moving, it's easier to keep moving.
Dang, you are filled with a bunch of good ones today. I'm taking that
I
one.
learned from the greatest.
I'm running with it. That's amazing. No, I couldn't agree more. I find like if you do come to for whatever reason, injury, life event, COVID, right? Like, and you come to a stop on your routine of physical movement or physical activity, it is quite difficult to start up again. I often notice it with some clients who maybe they've taken a break to go on vacation, or like something family wise kind of like, unexplainable happens, and then they try to like re-engage it. That sticking point at the beginning is a little bit tougher. Whereas if we were to just continue with it, or they're continuing with their own self-management and self kind of exercises at home, even if they do return, the takeoff and the trajectory of their progress is a lot like quicker, essentially, and it's a lot easier for them to get their goals. All right, so we're near the end of our little interview here. Are you up for a game of 5 rapid fire questions to wrap this up?
Always.
All right, I'm gonna try not to mess up, speaking quickly. There's no timer or anything, but when you're done the answer, right? You're done the answer and you say next or whatever.
Okay.
All right, here we go. What's the last movie you watched?
Turning Red.
Where's your dream vacation and destination?
Greece.
What's your favorite sport to play?
Soccer.
What is your favorite sport to watch?
Basketball.
What new skill or hobby have you acquired since the pandemic started?
Being able to use chopsticks. We ordered a lot of noodles, and I've never known how to use chopsticks. So over the last 2 years, mastered.
Dang, and there you have it. The ramen go-to physio. All right. Amanda, thank you so much for your time.
No
Guys,
problem.
Amanda Raguseo, registered physiotherapist, clinical manager of our Etobicoke clinic. You can reach out to her if you have any questions or concerns about physical therapy, 416-621-2506, and we'll get you in touch with Amanda. Thanks so much.
Thanks, Hong. Have a good one.
Bye.
Bye.